Go out this door to the left. There's 2 bathrooms on your left, and there's water and coffee in the back if you guys need it. So I will turn it over to Brittany.
All right, thank you, Elaine, and good morning, everyone. Like Elaine said, my name is Brittany Greenway, and I'm the Community Programs Coordinator here at Legacy Link. And one of my responsibilities is facilitating fall prevention workshops. And I'll tell you guys a little bit about those as we move throughout our presentation today. But today, again, we're going to talk about aging, mobility, and fall prevention. Okay. Here at Legacy Link, our mission is to advocate and support aging adults as well as individuals with disabilities and be their link to a better life. Okay. And diving right in. So today our topic is something that is very important to all of us, right? It's something that our families may be dealing with or may eventually deal with, and that is falls and mobility. Okay. So falls are the leading cause of injury in older adults. However, the good news in that is that falls are preventable. Okay, many falls are preventable. And my goal today is to empower you as caregivers and loved ones of those who may be looking to prevent falls and ensure that we instill confidence and things like that in our loved ones. Okay. So aging affects our movements, okay? And it's important to understand how aging affects our movements, okay? It's natural for our bodies to change as we age, and one of those things is decreased muscle strength. So lack of moving, and as we age, our muscles are not going to be as strong as they once were, okay? Also, our balance may be reduced. We may be a little less steady. Our coordination and reactions times may kind of decrease as well. And then vision and hearing changes, right? As we age, that can also be a challenge that we face. Additionally, stiff joints, maybe even pain, things like that come with aging. Although these lead to increased risk of falls, if we act proactively, then we are able to combat some of these things to reduce our falls risk. All right, and why do falls happen? Okay, so falls rarely happen for just one reason or another. A lot of times it's a combination of things that go hand in hand. For example, weak muscles lead to instability. Poor balance can lead to difficulty recovering from a trip. Medications can lead to dizziness or sedation. A lot of people don't realize that the medications that they're taking can affect their steadiness and what have you. And then there are also environmental hazards that can cause you to slip or trip. And if you put some of those things together, for example, if you have poor balance, right, and there's a loose rug that you go to walk across and you slip or trip on that rug, your recovery is not as agile as it might have once been, right? So a combination of those two can lead to a fall, and it's not just one thing or another. It's also important to understand that there are common fall risk factors, and there are 2 main types, one being personal and another being environmental. Those personal things could be, do you have a history of falls? Have you fallen in the past? Are you managing a chronic condition? Like, are your symptoms managed, or are they kind of a little bit out of control? Or even our medications. Like I said, if you're taking multiple medications, are there interactions and understanding what those may be and what limitations you may have based upon your medications? And then again, that poor vision or hearing, if that is something that your loved one is struggling with. And then the environmental things are things within our home or within our community, okay? That can be clutter, poor lighting, the loose rugs, unsafe conditions. You know, if you're stepping up on a curb that's broken or wiggly, you know, we've all done that, right? Stepped on something that wiggled just right, or a rock in a path or what have you. So those are 2 things to kind of take into consideration. Is your loved one at risk? Okay, you can do a quick assessment by asking these questions. Have they fallen in the past year? Do they hold on to furniture while walking? And do they feel unsteady or afraid of falling? And are they taking multiple medications? If the answer was yes to any of these things, then there is an increased risk for falls, okay? And that's something that should be addressed immediately and not later, okay? What can you do to kind of start addressing some of these things? A simple thing that you can do is a walk through the home, okay? You can look through living areas, bathrooms, and bedrooms. You are more likely to fall in your home than you are any other place. So this is one of the places that we kind of look at and kind of try to clear our pathways, remove any loose rugs. Things as simple as installing grab bars can definitely help steady someone or give confidence in the bathroom or in those slippery places while moving around. And ensuring that there are proper heights to the bed and maybe even the toilet. When we're young, we don't realize how far we have to squat to sit down on a toilet until that's really hard to do, or after leg day, right? So we always have to kind of think about that for our loved ones who it may be challenging for them to get to that level, right? So because that muscle strength is what, if that's reduced, then they're going to have a challenging time with that. Again, some simple changes that do work, right? Let's put things into action. One of the things that we can do is encourage our loved ones to move regularly, right? It doesn't have to be hit the gym 5 days a week, Granny. You know, it can be let's go, let's move around, let's take a walk, just simple things, right? Ensure proper footwear. Make sure that it's something with a no-slip sole, that it might have a back on it, something that's not going to flop on the foot, things that can help them be steady on their feet. Also improve lighting throughout the home because when we can't see certain things or the light is too dim, things can hide in the shadows or in a patterned carpet and what have you. And also keeping frequently used items where they can be reached, right? If there's something that your loved one uses on a daily basis, the top shelf probably isn't the best place for it. So ensuring that these simple things that you can put into action can be done just to keep your loved one safe. Our strength and balance is very important to keep our body strong, to ensure that we can continue to move forward in all the things that we're doing. Even just light activity, like I said, taking a walk, balance exercises, different things to maintain our strength and balance. A very popular class is Tai Chi, which improves the balance and movements and things like that. And two of the classes that Legacy Link offers, the fall prevention classes, one is a matter of balance, and that is a small group discussion-based course, which is for 2 hours, once a week, for 8 weeks. And that goes over different exercises that can increase balance, strength, and flexibility. And then again, some small group discussion goes along in that as well. And then we also have a class called Bingo Size, and it is exactly what it sounds like. It's bingo mixed with a little bit of exercise, and there's some trivia thrown in there too. Okay, so we call some bingo numbers, and we do some exercising, and then we talk some trivia. It's more of a fast-paced, fun, interactive class that people so far that I have taught the class to have enjoyed that. So just some things to keep our bodies strong. All right, and we'll talk about some health factors, right? So some of the health factors that can play into our fall prevention is our vision and hearing. So again, if you can't see well right in front of you or even far off, you may miss a trip hazard or a fall hazard that's in your pathway, right? Or even hearing. A lot of times people don't think about how massive and how much work our brains do for us, and all of our senses play into our balance and our mobility. So hearing, when that decreases, it can affect our steps and different things like that. So it's very important to keep those exams up to date. Also, meeting with your doctor pretty regularly, especially if medications change. As we age, we may see more than one particular doctor, right? There may be a couple of specialists involved there, and not always do the doctors communicate. So the pharmacist is also a really good point of contact when reviewing medications, ensuring that there aren't negative reactions between the medications that are being taken. And if so, kind of being able to work through those and manage that a little better. And then again, managing those chronic conditions effectively, ensuring that whether it be medication or exercise or diet or whatever we need to be doing to ensure that we're not giving other symptoms that are causing other reactions with certain things. Everyday safety habits. So our daily habits matter, right? And a lot of people, you may fall into a routine or of a habit of this or that. And, there's all kinds of books and different things out there. Oh, if you can do it at least for 30 days or do it for however many days, you can set a habit. But ultimately, we want to ensure that our habits are safe and we're encouraging safe habits with our loved ones. So we can encourage them to stand up safely, to ensure that they're not going to get dizzy, or if they do, they do it slowly so they can kind of get their wits about them before they start moving. If a cane or a rollator or a walker is recommended by a health professional or something like that, encourage them to use those assistive devices to maintain their independence. Try not to rush, right? We want to avoid being rushed, especially in the dark, right? If anybody's waking up or entering the house or out of the house in the dark, it can be, troubling to see in the shadows. So make sure we're taking our time and moving safely. Another thing is to stay hydrated, okay? So not taking in enough fluids and different things like that can lead to dizziness, dehydration, and a lot of other things that can cause us to have unsafe movement. So falls are not just a physical thing, right? Falls can definitely have an emotional aspect to them, right? People, your loved one may know someone who has fallen and suffered injury, or they have fallen and suffered injury, and so now a fear may be instilled, okay? So when someone is afraid of falling, or they have fallen and they're afraid to do it again, it can cause reduced activity, okay? And when they think that, well, I'll just sit at home on the couch or in my chair, right, so that I am more safe, that leads to lower muscle strength, isolation, potentially depression, and a lot of different things, right? And it also, they will lose their independence when they are no longer able to be mobile in the ways that they once were, okay? And so it's really important to understand that, again, not just physical, but emotional aspects of falls as well. So what can you do to help your loved ones, okay? So having the conversation about mobility can be a very sensitive topic when you're thinking about it for yourself, or even talking with a loved one about it. So start those conversations in a very gentle way. Try to practice, empathy and understanding. Focus on, how are you going to keep your loved one's independence rather than taking that away, okay? Don't do it as a controlling factor, right? You want to do it more so as a let's work together and see what we can do to come up with something that works well for you but is also safe, okay? Allow your loved ones to kind of be in the know and work with you on those decisions about those changes that may take place. Small changes, right? Especially if it's something that you're presenting to a loved one and it wasn't their idea. They may not be ready to completely jump off that cliff, right? But one step at a time is how you climb the mountain. So little things, small changes can also instill positive habits as you move forward. So safety equals independence, right? So staying mobile allows your loved one to age in place, right? If they are able to move about, they're home safely and they can get into the kitchen and cook, and they can get into the bathroom and use the grab bars to shower and some of the other things, they're going to be more likely to be able to stay in place. And safety, also when your loved one feels safe, they're going to have the confidence to remain more mobile and be able to move around more than if they felt unsafe. Okay. It will also reduce their hospital visits, right? If they are moving around safe, having less falls, reducing those risks, and again, not having serious injury that requires a hospital visit. And it also maintains their dignity and confidence, right? When your loved ones are able to age in place and have that independence and have a say-so in what they're doing, they feel more confident in just their lives and overall well-being. Ultimately, fall prevention is about a quality of life, right? And not just what you feel like your loved one should be doing. You want to ensure that they are living well and safe and, again, with quality. But what can we do today, right? So we can start with one of those small steps of doing a home walkthrough, okay? You can schedule a checkup with the doctor or schedule a medication review with a pharmacist. Even talking about those mobility concerns with your loved one so that there is a plan and an understanding, again, between you and whomever you may be caregiving for. And then, again, small changes at a time are very important to instill, better habits moving forward and safe habits, so to say. So there are many professionals such as physical therapists, occupational therapists, your local senior community programs between the senior centers and your local area agency on aging that can help provide information and resources to ensure that you and your loved one feel confident in some of the things that you are looking at doing to prevent and reduce your falls risk. I would like to kind of share again, ultimately, that preventing falls isn't about limiting your loved one's life. It's about protecting it. So having an idea of how you can do that together is going to be what kind of helps and pushes things forward in the most positive ways. So ultimately, safety is the goal, and quality of life is also right there up beside safety. So maintaining that independence and confidence for years to come is what will come out of some of those positive movements forward and falls, reducing our falls risks. So any questions?